Good morning. I'm Larry Bolton. I'm a counsel to this, legal advisor to this project. I had previously, in a former life, been for many years chief counsel at the Department of Social Services and also on and off as chief counsel at the agency. So I've worked with many of the different departments that we've been talking about over the last years. I'm also a member of the Blue Ribbon Commission on Foster Care, which is where this issue of interoperability first came up as a major issue. And legal advisor to the Child Welfare Council, which has been talked about earlier, has endorsed last summer a strong resolution supporting information sharing and interoperability. In 2006, when the Chief Justice appointed the Blue Ribbon Commission on Foster Care, it brought together folks from all the various agencies involved in the courts. And at one of the luncheons, I was speaking with Judge Stout, who is a juvenile court judge from Central California, and became aware that the courts were in the midst of designing a court case management system for child welfare. And we were on the verge, we thought then, of building a new system for child welfare, which has yet to be rebuilt. What was interesting is we assumed that we were working cooperatively, and we found out after meeting with the staff working on each of the systems that the court case management system was being designed with no input from anyone in the county counsel's office or the child welfare departments. They had thoroughly had everything approved by the presiding judges of the juvenile courts and the court administrators, but never talked to the other partners in the programs. And so, fortunately, Diane Nunn, who I think she's trying to get her bags out of the hotel. Diane Nunn, who's been here the last few days, she's the director at the Judicial Council of the Center for Children and Families, had folks go back to the drawing board and get the other participants involved and designed a system which would be collaborative and would serve the needs of all the parties involved. It got me thinking to realize that when we had designed our child welfare system originally, 24 years ago, we were designing it specifically to make sure that no one could possibly have access to it under any circumstances that didn't work in a child welfare department. The big news at the time, and it was state of the art, was the federal government approved, after a lot of arguing, that we could have color screens for the terminals, and so that tells you about what we were dealing with. But we've talked about building silos here. We weren't just building silos. When we designed that system and the other systems within our department, we were building fortresses. I mean, they weren't just tall towers. We had moats. We had, if we could have poured alligator, good idea. We thought of boiling oil to pour down on but we never considered sharing information with anyone because this was our information, and the main concern was privacy. When I began my career in state government, I just realized I graduated from law school 40 years ago this week. My first job, yeah. Justice Ray said, I'm the old guy, but at any rate, my first assignment, I was working in Governor Reagan's Office of Criminal Justice Planning, and we worked on the Federal Privacy Act of 1974. Immediately post-Watergate, we were enacting privacy laws everywhere, and they were good and necessary and important. And since then, we've added FERPA and HIPAA and so many other unique laws for virtually every program we've gotten. And there's been a huge emphasis on privacy and security, and it is important. However, I think oftentimes, particularly as lawyers, have a tendency to be focusing on protecting our clients from liability and advising them whenever you get a confidentiality question. The easiest and safest answer to give on information sharing questions is always no. You can't, if you don't share it, it can't get lost, you can't be sued, et cetera, et cetera. But we end up with situations where people who have to make decisions don't have the necessary information they need in making those decisions. When we see to it that foster parents don't have any access to health information on the kid, and then when the child has an asthma attack and the foster parent has never been told the kid has asthma, we go and we decide, well, my God, we have to revoke their license. They're not adequately supervising that child or meeting their medical needs. Well, then you find, oh, but we didn't tell them. We need to find ways as lawyers to make sure that we're in compliance with the appropriate privacy and security laws, and confidentiality is important, but also find ways to focus on on better meeting the needs of the clients, the elderly, children, whoever in the various programs. We put together a panel today. We've got representatives from state government, county government. Richard Gold is going to lead off with kind of a national picture, as well as advocacy groups. I think the more, as we design our new systems in the future, my hope is that we will have advisory groups of lawyers from the various, from the advocacy, county, state, et cetera, to participate in designing a system that will better meet everyone's needs. And as they indicated earlier, there's sign-up boards. We're looking for help, not just in child welfare, but in all the different areas. So we're going to have, each person will talk for a bit, and then at the end we'll take questions from everybody. And so we'll start off with Richard Gold. It's a short panel. The bios are in your paper, so I'm not going to go into any more detail than that. Richard?
Thanks. I thought you were going to say we'll begin with a short person, Richard Gold. I was going to say, well, it's true. Good morning. I'm a recovering lawyer, or a recovering active lawyer. Not 40 years, but close to 40 years. For about 30 years, I practiced law, and then tried my hand at state government, being in the executive branch. And when I left state government, I had the opportunity to begin working with Stewards of Change. And my first assignment was for the federal government, the Administration for Children and Families, under Deputy Secretary Carmen Nazaria, who was the first appointed deputy under President Obama for this agency. Realized when she came into the federal government that even within ACF, departments didn't communicate with each other. And she believed strongly in a client-centric approach to services. So she very much was a pioneer. And one of the things she found out was that confidentiality was used as a stop, a red light, a cliff, even within the federal government. And so she commissioned a confidentiality toolkit to be drafted to share with states on how to share information, recognizing the applicable federal laws, and outline the federal laws as really a guidebook for states to take and then use to review their state laws in a similar manner to figure out specifically what information can be shared, that being it's not confidential. What information is confidential, but how do the laws say it can be shared, meeting the confidentiality rights of the client. This toolkit, we've had 3 deputy secretaries, and the scope of the toolkit changed, sadly, from Deputy Secretary Nazario to the present. She really saw it as, how does ACF share information amongst its services and its areas that they control, as well as other areas of the federal government. So under ACF, ACF covers TANF, child welfare, child support, child care, and LIHEAP. They are its programs. And she really wanted those programs plus health and Medicaid, mental health, drug and alcohol, and education. So it was a much broader toolkit at one point, but I'm sad to say that there is a final document that has been drafted, and we've been told that it's pretty imminent, its publication to the states. That's the good news. The sad news is that it will only deal with in those areas that ACF covers. So it will not deal with health, Medicaid, education, mental health, and drug and alcohol. That although most except education are under HHS, not under the domain of ACF. So I really view it hopefully as a beginning toolkit. And it's written for laypersons. So it has specific charts for each of the laws that in the areas that ACF controls, where it shows where in the law it discusses confidentiality, what information can be shared with citations, what information is confidential with citations, and the exceptions to those confidentiality rules with citations. So it is a document to get to yes. It is a document to be used by state administrators, state program people, and state attorneys to really get to yes on a state level. So it's broken down into what information are you looking for, because that's very important, that it's not all information that everyone has, it's specific information, and what's the purpose for sharing it. Getting back to information is important, but too much information is maybe useless. So it's an exercise in figuring out what information you need, why you need the information, how you're going to share it. And there are examples of different consents and authorizations that are used around the country, memorandums of understandings and intergovernmental agreements showing how information will be shared. And last but not least, who will have access and therefore who will not have access, and how the information will be maintained with security. And there is a technology part, which I had nothing to do with drafting, because my answer would be, well, you push this button and then that happens. And it wouldn't have been a very helpful tool. But with the help of Johns Hopkins, we were able to write a technology part to this guidebook so that it's hopefully a tool for states to really get to work and not have to redo the federal laws, but really look at the applicable state laws. Many times the state law might be more restrictive than the federal law, and looking at what needs to be or how you both protect people's rights to confidentiality and share necessary information to be more effective for the client and more efficient as government. It's also sort of peppered with examples throughout the country. So it's not a bestseller, but it's not a legal horn book. It's really written so that caseworkers could read it, as well as agency heads and agency attorneys. I had it edited by a non-lawyer so that all legalese was removed from the text, and she was a great editor. So just some examples of places where information sharing is going on and people's confidentiality rights are protected, and they have not been fined by the federal government. They haven't been raided by the HIPAA agents. They still are in existence, some of which have been discussed already, including New York City's HHS, which is pretty incredible. It's a client-centric approach to service delivery, and under Mayor Bloomberg, he took 9 agencies. And let me just read the agencies because, coming to California, there's no place bigger than California. Then when I take an Amtrak to New York City, there's no place bigger than New York City. So I'm confused, but I'll just remain confused, but keep my coast straight. The 9 agencies are the Department of Aging, Corrections, Health and Mental Hygiene, which is mental health, Homeless Services, Children's Services, Juvenile Justice, Probation, both adult and children, Health and Hospitals Corporation, and Human Resources Administration. So it's a tremendous enterprise. It's still being fixed and expanded and worked on, but it is a testament to hard work and getting to yes, and it's being used by the New York City employees and consumers. So it is something to see. I recommend you going to their website and really going through it. Colorado has an information collaborative with 9 different state agencies that's been in existence for about 4 or 5 years. They too are a recipient of one of these federal grants, and they're building on this successful collaboration to expand to more state and county agencies, since county like Colorado, like California, is a county-administered system. Texas, by law, passed the requirement of having an electronic health record, which is interoperable for children in foster care. And last example is the Montgomery County, Maryland, where the executive of the Health and Human Services Agency revamped the government of this county to create a human service agency, truly breaking down the system silos, and working very hard to create a very clear consent form for clients so that they understand how information can be shared. So that's the national viewpoint. It doesn't include every federal agency, so we could talk about this agency doesn't want to play nice and that department doesn't want to play nice, but it is a start. So, thank you, Larry.
Appreciate it. I would mention also, you talked about the other states. California, I believe, is the only state where the voters by initiative put the word privacy in our constitution. So we have an extra level of scrutiny that we've got to meet here in California. And that was done, again, in the 70s, the Watergate era. So, Suzanne, Giorgi?
Hi, my name's Suzanne Giorgi. I work with the department, or with Health and Human Services, especially in the Office of Health Information Integrity. And in that position, I've had the opportunity to kind of see the process that we as government have been using to try and get to yes. So at Health and Human Services, recently we've had some different agencies or departments folding into the Medi-Cal program. And so part of the way to get to yes was leadership in the agency. Leadership to pull together these shotgun marriages and making them work. Identifying the problems and then working with the staff there to get to yes. Then also with Cal Ojai, we've been doing a lot of public, private, collaborative efforts. And we've been in that realm for at least 7 or 8 years. First starting with the HIPAA implementation, working with a lot of the county attorneys and privacy officers. Then we moved into health information exchange, and we were doing that in 2007 and 2008. We started up with the Privacy and Security Advisory Board. Then we had the Health Information Exchange expansion grants, and we're continuing in that effort of bringing in the public and the private partnerships, collaborative efforts, bringing transparency to the process, and really working in that cultural change based upon knowledge and need, and just building trust to facilitate the exchange of health information. So one of the key things that I would say that you've got to do at the very beginning to get to yes is to level set on what is the applicable laws. So I kind of crystallize it as some of the laws apply to entities, like HIPAA, your covered entities. Some laws follow the data, like the CMIA, Information Practices Act. Those of you who've ever signed the Social Security Administration agreements on the Social Security numbers, those follow the data. And most of the trouble that I have seen is you'll work with an entity that is very familiar with their law, and their law follows the entity, and you're working with another piece where their laws follow the data, and just trying to harmonize which law prevails. How do you do both? So do you remember Shell Culp's slide from the first meeting? She called it spaghetti. All the data elements going to all the entities. Well, this is why you have to get your lawyers in early, because each one of those data elements could have 1, 2, 3 federal laws, state laws applying to them. And as you leverage or transition them, more laws will attach because it went into an entity that has its rules. And going through that spaghetti is hard. It's confusing. And I'll push back on Larry blaming the attorneys. You got to get them in early. If you're an attorney who's used to only one set of laws, and you're now saying, but you didn't look at HIPAA, it takes a while to come up to speed on someone else's laws. And it takes trust. Trusting the expert in one field and sharing with you your laws and trying to get to that accommodation. What can be permitted, what cannot be permitted. And another thing we learned in California in our public-private, some of California laws are Easter eggs. You can't find them. You got to find somebody who knows where those Easter eggs are. And it's really hard to come into compliance. So one of my projects, and it'll probably make people in the back of the room shake, that I was working on was law harmonization. And it was hard. We didn't succeed. It was like climbing Mount Everest. And I'll tell you, people are still bailing off saying, we got to find a quick fix. This is hard. But when you look at and try and map all of these applicable laws, and you try and get to where we want to be, it's just not going to work. Or at least that's my personal opinion. It's not going to work. You really do need to look at a global law harmonization. So bring the attorneys on early, level set on the applicable laws. The future. Changes in technology and in consumer expectations are shifting us away from that model of only people with red hats and white dots can get the data. Oh, wait, we have red hats, blue dots. Change the law so the people with the blue dots can get the data. We're getting away from that. It's too dynamic. Look at the life cycle of your data, how it's collected, where it's going to go, how is it protected, and how is that protection, that security being monitored? How transparent is it to the data subject? Who has their data for what purpose? And if we truly are evolving the purpose, how do we do a notice to the patient or to the individual when we're collecting their data? We're collecting your data, but we don't know why. You can't do that. But that's what we're doing. So how do you build that trust? How do you build a transparent system in which you are fostering privacy? And part of that answer is privacy by design. Some of you have heard it. It's where you understand the point of view of the data subject and you accommodate, you listen, you build into the beginning structure their needs, their wants, their desires. You say you're patient-centric, talk to the patient, find out what it is that they want. What are their concerns on privacy? And I want to push back on another part where the idea that we're all consumers and therefore we know. Most of us are from government. We trust government because we kind of get it. But a lot of the people we service, that we help, they don't have that trust factor with us, and we have to earn it. And more importantly, we have to maintain it. And getting the patients, the patient representatives involved early, understanding that that's our baseline of expectations, we're going to move away from these little technical laws that absolutely don't make sense where we're going. But we're going to have them at the center, and we're going to meet their needs by listening to them and building the system to accommodate them.
Thanks, Suzanne. And I don't think I can underscore enough the importance of getting the attorneys involved early. It makes all the difference. When the program and technology people work alone and then bring a product and the attorney says, oh my God, there's 8 different federal and state law violations there, that's how legal gets everyone has the impression that they're nothing but a roadblock. If they're involved early, hopefully they can help facilitate ways to get to the goal that's being sought. And actually, our next speaker, Kristina Robb, is going to give an example of a successful outcome where had the attorneys been involved earlier, it would have gone even quicker, but they were able to resolve an issue. So, Kristina?
Thank you. My name is Kristina Robb. I'm a Deputy County Counsel with San Bernardino County, and I was asked to give the county perspective on information sharing and interoperability. And I will say that at the county level, we are very pro information sharing. We understand the importance of getting our clients connected with services across the county level, not just with our own individual departments. And so we really would like to move towards the getting to yes mindset. But unfortunately, there are a couple of roadblocks in our way on the legal side of things. Those particularly being statutes and regulations and contracts that restrict our ability to share information. And so some of the ways that we would like to see that getting to yes being made easier would be on the statutory side. I've heard a lot of talk about starting with the yes and then working towards, well, is there a reason why we can't share information? Unfortunately, our statutory scheme isn't really built like that, particularly in welfare, where you have Welfare Institutions Code Section 10850, which starts with a no. Everything is confidential. And then if an exception applies, you can share it. So I think there needs to be a legislative change or shift away from that idea where, yes, information is confidential, but we recognize the importance of sharing information. And if it's going to benefit the customer, and if you're going to protect the information, then yes, go ahead and share it. So that's something that maybe we as a group can figure out how to work towards in getting that across to our legislature. And then the regulations would flow from that change. The other part of it is contracts. Over the last 5 to 6 years, I've been seeing more and more data access contracts coming down in the world of welfare information. Suzanne mentioned Social Security information, tax information, mental health information. And as part of those contracts, we have tighter restrictions on who you're allowed to share that information with. And that's really not doing such a great service to our clients when we're really wanting to share information. Maybe one of our CalWorks recipients could benefit from mental health services, but because we're both under a meds access agreement, we can't share that information. And so, as Larry pointed out, one of the key things is getting your attorneys involved earlier, getting I think from the state level, getting your counties involved when you're contracting for data access so that we can really have a dialogue and discuss what the contract is actually going to do to us in terms of being able to share information and provide services to our clients. And as Larry mentioned, we had one situation come up last year. For those of you who may be familiar with it, it was the Medi-Cal Data Privacy and Security Agreement, PSA for short. And just to give you a brief history on that, back in 2007, I believe it was, the Social Security Administration at the federal level came to Department of Healthcare Services and required them to enter into an agreement for receiving SSA data. That was called the 1137 agreement back then. Part of that required the state to then go to the counties and enter into contracts with the counties to protect the data and also restricted sharing the information. So around 2008, the counties and the state engaged in discussions and negotiations over what ultimately became the PSA. That was signed, I believe, in December 2008, sometime around there. 1 year later, the SSA and DHCS agreement was set to expire, and so they entered into a new agreement that had pretty much the same requirements, couple added things, and also required new agreements with the counties. So flash forward to last year, spring 2012, a new agreement was drafted. I'm not sure where it started or who had input into that, but DHCS sent it out to the counties. It was sent to CWDA, who was supposed to distribute it to the counties for input. And it was circulated to a few counties. Unfortunately, a lot of the issues that most of the counties are going to have with the agreement weren't addressed at that time because it was only sent to a small population of counties. And one of the big things was that in the former PSA, it's as to Medi-Cal information in particular. And for those of you who are familiar with county Medi-Cal eligibility determinations and HIPAA, we're carved out of HIPAA. We aren't required to comply with HIPAA on that end. And we've tried really hard at the counties to keep ourselves out of the HIPAA umbrella for multiple reasons, and under high tech for lots of financial reasons as well. The new PSA, unfortunately, was drafted to include compliance with HIPAA. And some of the counties that looked at it at first didn't realize that HIPAA issue was present. So there was a back and forth between CWDA and DHCS, and that resulted in a final contract that was provided in draft form in September of 2012. Well, at that time, counties started finding out that this contract was in existence. We finally got a copy. Counties that were like mine, where we have hybrid entities, our welfare is very separate from our HIPAA-covered portions of the county. Red flags went up all over the place because we tried very hard not to be subject to HIPAA. And the fact that this agreement had major HIPAA ramifications for us was extremely problematic. So we, my county and some of the northern counties got together and immediately sent up red flags to CWDA, California Welfare Directors Association, for those of you unfamiliar with the acronym, and forwarded those concerns to the program folks at DHCS that we were working with. Well, unfortunately, the response back was, we gave you guys this information back in spring and you never brought this to our attention, so the contract is final. It's as is. Well, we weren't really willing to take that answer, so we pushed back a little harder. The final contract was issued, and a CWDL was sent out instructing the county welfare departments to sign the contract by December 10th. So we got together at the county side and started working with our county councils association to really build momentum to get changes made to this contract. Oh, by the way, in spring, no county councils had been brought in to look at the contract. So that
I think that's an important point. When you were talking about the counties reviewed it, it was not the county councils.
Right.
And
Yes.
This gets to my point, getting your state and county council involved early in the process rather than after it's finalized. So
Yeah, and so it wasn't until September that actually county councils got it in front of them and were able to look at it and see the legal issues with HIPAA being involved. And so we started gaining support amongst the counties. We kind of teamed up and outlined what our issues were, why we were opposed to the HIPAA provisions, and some of the other issues that were present in the contract. Forwarded all that to DHCS, and at this point it was pretty much just the program level people that we were dealing with. And again, we received a letter in December saying the contract is final. We'll consider your changes for future contracts, but right now, this is what we're going with. Not taking and lying down, we pushed back again and actually managed to have a conference call between DHCS program folks and our county council representatives. And during the call, we were again told, sorry, this is a final contract. We're not going to make any changes to it at this time. That's when I called Larry. And we really wanted to see if we could get to the legal team, because we thought that if we could explain our legal reasons for wanting to get changes to the agreement, we would go a lot farther than just talking to program people that might not necessarily understand the legal ramifications of what we were asking for. And thanks to Larry, he was able to...
Wait. No, I didn't do that. The people that worked this out with you were the attorneys at Healthcare Services and the Jerry Scribner at the agency, et cetera. I was the messenger, but I don't want to...
No, I was going to say thanks to Larry, we were able to get to the DHCS Counsel. We worked with Suzanne and her team. Yeah. Larry's being modest. And we really provided detailed information about why we wanted these changes to take place, what the ramifications were for us. And Suzanne looked at those and was able to amend the contract in a way that met all of our needs. And so that was in March, I believe. We had our conference call and went over everything. So it took between 6 and 7 months of fighting back and forth to actually get to the point where our concerns were heard and the changes were made, whereas if we had started a year before that, a lot of these issues probably wouldn't have come up.
I think in terms of lessons learned, I think when it went to the Welfare Directors Association, it would have been good had they sent it to the county councils, et cetera, because in this case, Suzanne and Pat Pechtel and Doug Press and Jerry Scribner, once the issues were elevated, I think that it was a collaborative process which resolved things to, I think, everyone's satisfaction ultimately. And I think the lesson from my perspective here is on all sides, let's get the lawyers involved early in the process rather than later on. So
yes, I would agree with that. It's very important to get county council input as well as your program councils at the state level input at the beginning of the process, not once the state's comfortable with something and forwarding it to the counties and giving us a slim opportunity to comment. It really should be an interactive relationship where we're given a good amount of opportunity to input on things that are going to affect us and affect our clients. And part of that is really changing the dynamic. At this point, it seems like we get contracts and it's like a beg and plead to get changes made, where it really shouldn't be that. It should be, here's the contract, we really value your input, please tell us what changes would better serve the county, and then we work together towards a common goal and a contract that works best for everybody. And so I think a change in dynamic between the way that the two parties work together would best serve the counties, the state, and the clients that we serve.
And that is actually where we are now. We had a good talk, and as Larry said, actually there's one big piece that was kind of left out of that, which is that the County Welfare Directors Association was a part of the negotiation of that contract from day one. And we at DHCS were actually told that the counties were represented, that they had vetted the contract all the way through. So we were under the impression that the lawyers had seen it and that everything had been through everybody. Now we know, we didn't know then. So as soon as we found out, we got together and worked with the County Counsel Association to come to a place where everybody said yes. So we got to yes very quickly. And at the end of that call, the result was that going forward, there would be discussions from the get-go between the County Counsel Association and DHCS for any further PSAs.
Yes, and we appreciate that. I'm talking more along the lines of other contracts that might be coming down the pipe or in the future, if they could start at that level.
Right, and I think there's been lessons learned here both by the state and by the County Welfare Directors Association. Jerry?
I just wanted to add one more point, and that is always remember that 50% of all lawyers are wrong. Only one lawyer wins the case. So there's lots of room for discussion, and maybe one of the lessons from this was, as Pat said, a group of county attorneys had passed on the proposal as okay, but then other county councils looked at it individually and separately and concluded it wasn't okay. So we didn't have everybody in the mix we needed initially. But it still comes to the same point. Getting to yes requires a lot of consultation, and it requires a commitment to getting to yes. And if you can't say yes initially, figure out a way to get there. Thanks.
Thank you. And what I'd suggest is, and I think these clarifications were important and appropriate, but in the interest of time, maybe we'll finish off with the force and then throw it open to questions from everyone. Or were you finished with your?
Oh,
yeah. Okay. All right. And from the advocacy community, we're going to have a presentation now from Rebecca.
Thank you. I'm Rebecca Gudeman. I don't know if it's good or bad to be the advocacy community, sort of wear that hat, but we'll see.
One of the advocates.
I'm a senior attorney at the National Center for Youth Law, which is a private nonprofit advocacy organization in Oakland. And as you might guess from the name, we work to improve outcomes for youth, and with a particular focus on children and child welfare and juvenile justice systems, among others. And part of my work there is to be the privacy information sharing lawyer. In that role, I've, in collaboration with the Administrative Office of the Courts, done a number of trainings in counties on the multiple layers of laws, as Suzanne mentioned, sort of making sure we've got all the laws and all the folks at the table. And I've also done some technical assistance to agencies trying to develop information sharing policies. I'd actually like to start by going back to a theme that's been mentioned over and over, and that's this idea of appropriate information sharing. We've all acknowledged, I think it's universal, that this isn't about sharing everything, it's about finding that right balance. And that's not just a question of who should have access to information, but also about how much information. And as you might imagine, I'm going to use examples from the child welfare arena, because that's what we do. And I'd just like to sort of put some really concrete stuff out there as we try to process what does appropriate mean and what is the right amount of information. As I said, it's not just about the who. It's not just flipping the switch and saying social worker, yes, parent, no, caregiver, yes. But it's also how much does that social worker need? How much does that caregiver need? And there's a real risk of both under-sharing information, but also over-sharing information. So just using mental health information as an example, it's one that many consider sensitive information, but also very critical to make sure it gets to appropriate people. Let's think about that foster caregiver. Probably most of us would agree, as Larry said, that it's very important for a foster caregiver to have information about medications that a child might have, diagnosis, treatment they're receiving, so they can help them get to that counseling session or to that psychiatrist's appointment. But there's a lot of other layers of information. I had a therapist share with me once that there was a child who was molested, but only molested at night in the dark in his bedroom. And it was really important to let the caregiver know that this child probably needed a nightlight, or might have a really strong negative reaction if put in a dark room. You can imagine if that kind of nuanced information didn't get to a caregiver, there could be really bad consequences. It could maybe even make that care situation blow up when the foster parent doesn't understand what's going on. But how do you tease out that kind of information and get it to the right source? And does everybody need to know that, or is it just the caregiver? Another example that I was recently told by a dependency counsel, a young woman had been in several months of counseling, finally started to share more details of the abuse that she had suffered at the hands of various family members, started sharing about abuse at the hands of her grandfather. No one had known that. Really important for perhaps her social worker to know, for the court to know as they're trying to make placement decisions. But very detailed information, including quotes from her, went into a court report that was presented in court, and her parents got access to it. Several days later, her parents cornered her outside of court and started calling her a liar and a traitor. And she came back to her therapist and said, I'm never going back to to her attorney and said, I'm never going back to therapy again. I can't trust what's going on. There's real harm in oversharing as well. I could give you case after case, and I'm sure others in the room who practice have many cases too, both the undersharing and the oversharing. But I hope what is starting to become clear is that this is often a case-by-case analysis. It depends on a number of factors, not least of which age of the client, the type of services they're being provided, even their status. Is this someone who might be reunified with their family? Is this someone who we know is going to be in the system until they transition into adulthood? Just a lot of levels, and we need a system when we're thinking about electronic databases, when we're thinking about systematizing this to facilitate timely transfer of information. We need to keep in mind that we need some flexibility. How do we, if we're turning that switch for social worker access, how do we segregate fields so that we make sure everyone's got the medication and the diagnosis, but there's the other layers in there that we can sort of turn on and turn off in different ways. In addition to that, the how much and sort of the case by case, another question is who's the decision maker? Who's the decider about how much information goes out? I love that decider, so I'm going to keep using that one. In some contexts, that's a really easy question to answer. If it's an adult consumer, we say, of course, they should be the one signing the authorization forms or giving you permission to put their information into a database. But when we're talking about children, and in particular when we're talking about foster children, there are a lot of folks who you could very appropriately make a persuasive argument should be the decider. The parent, the biological parent, the caregiver, the lawyer for the child, the court, the social worker, the child welfare agency that has supervision over the children. And in fact, if you look at our laws, what you will see for foster children is that we actually give these rights to multiple people. So just again, as an example, mental health care, when someone's authorizing a release of medical information under our CMIA Act, the person who is authorized to sign that release is the minor, if they could have consented to counseling on their own, which most can at 12 or older. If it's not the minor, it's the legal representative. Legal representative isn't defined in our state law, so who is that? You also have to consider evidentiary privilege. Evidentiary privilege has to be waived to bring information into court or to put it into some of these databases. Evidentiary privilege is held by the minor when they're 12 or older, or their lawyer if they're under 12. So now we've got parent, legal representative, lawyer. you can imagine, if we're talking about FERPA education records, FERPA says the parent or person standing in place for the parent that signs. So there's, this is the kind of stuff that Suzanne's talking about when we're talking about harmonization, and it's possible to make this work with all of these different definitions and terms, but this is why those lawyers need to be there. What I want to just end with is a description of a success story, particularly around, well, I will call it a success story, in a county where they took some of these critical issues and sat down and said, how do we work this out? The how much, the who decides, the how do we systematize this? And that's a project that occurred in Alameda County. I was not at the table actually making decisions, but I got to sit at the table to hear some of the conversation and participate a little bit. And what had been happening is there were cases of undersharing of mental health information or oversharing that were leading to harm of children. There were practitioners sharing with different interpretations of what they were supposed to be sharing, therapists, social workers with different understandings. And what they did is they finally got around one table, County Counsel representing the Child Welfare Agency, and actually she's here right now, Vicki Wu, right there, County Counsel representing the Mental Health Agency, a representative from the organization that that represents children, the Dependency Council for most of the children in Alameda County. And they also had the program folks. They had in particular, the Director of Children's Mental Health to provide the perspective from the program side. Now, this may not be fair, Vicki, so you can tell me if you think that this isn't right, but I was at one of the initial meetings, and I do think that there was a little bit of tension in the room. There had been a lot of hard cases and folks on different sides, but they met together over the course of a year. By the end of the year, I think that they really developed a great working relationship, a lot of trust as they walked through a lot of these hard questions. And they've now developed a protocol for sharing mental health information about foster youth. And one of the key things they've done is really segregate out what's called the circumscribed information, and that's lingo that comes from some case law, to hang your hook for the lawyers in the room. But it's sort of the basic info that we say, yeah, this is probably really important for, in most cases, that everyone gets. The very basic, the diagnosis, the sort of the nuts and bolts stuff. We're going to let that flow in a way that's systematized, that we're not going to worry about people throwing up barriers. And by doing that, but we're also going to have a system that allows us sort of in a more discretionary case-by-case way address the issues where we may need more information. And they do have backstops built in so that, for example, the dependency attorney can raise concerns if they think too much information might be shared. But by sort of segregating out those different pieces of information, it lets them, I think, focus more time on those tough cases where you do need that case-by-case analysis and more easily let flow some of the other basic info. And Vicki, correct me if I said anything wrong there, and I'm sure Vicki could share with you the website if anyone wants to see some of the materials that they came up with. But I think that was a real success story, and it does show that we can get to yes, even with very complicated laws, and even being sensitive to some of these difficult questions about appropriate and how much. And again, I think the key was the lawyers were in the room with program people from the very beginning. That's it.
Vicki, did you want to comment on, or don't want to put you on the spot?
Well, I think one of the differences, or I should say, one of the things that worked well for us at the time. One of the things that worked well for us at the time is that the council who were in the table, or around the table rather, who were having the discussion, we actually all had a working relationship before we started the project. So the three major players, myself, my colleague representing behavioral health, and minors counsel had all practiced in the dependency court, 12 years before we did that process. So we knew each other. We had a working relationship. It was a easier beginning, if you will, if you don't know the people that you have to have that conversation with. We all started with an understanding that, there's complaints on both sides. As Rebecca said, there's undersharing because the child welfare workers are getting name, rank, and serial number from the mental health professionals saying, yeah, they're coming to therapy. That's nice. We need a little more, and then on the oversharing where we have the quotations in, the report that, a therapist says, well, you guys need to know this. And the child welfare worker's like, this is important, and plugs it into a report, and bam, you have fireworks at the dependency hearing. So there was the whole range of, what was appropriate, what was not appropriate. So getting the counsel there together, I had my client there with me from social services. We had behavioral health client, agency there with us, and it was helpful, especially having behavioral health there as a client perspective, because it was a different culture that they're operating in terms of with HIPAA. You don't even acknowledge that that's a client. Somebody calls the child welfare worker, calls up the therapist, and they're like, yes, do you know this kid? Maybe, they're very protective of the information. So
Absolutely.
If you speak with the person who was participating in the process, his view was getting the service providers to center, instead of being out on the left or the right side, whichever one you pick,
Right.
but saying that everything was closed and you couldn't get information. It was bringing them back, everybody back to the middle of understanding there's a certain set of information that we need, the information that the court needs to make the decisions with visitation, custody, whatever it might be. And then you have what we called the super secret stuff that counsel would actually assert privilege,
Right.
Evidentiary privilege to, but that the therapist believes that for case management, that information needs to get to the child welfare worker. So the secondary part of the process is to actually identify that information, and the child welfare worker will keep it confidential. And make very general reference in terms of, like, for example, a placement issue. If there's a reason for a placement change, they may put in there generically that based on information shared by the therapist. So that would be the trigger for minors counsel to be able to assert at the hearing, we're not letting this out. And if parents say, no, I demand to know what the information is, then we go in camera
Right.
with the judge, and the judge decides how much of that information is actually being shared. So you have the evidentiary privilege covered, you have the general sharing covered, and so far the process has seemed to work.
Sounds like a good model, and part of the value of conferences like this is having an opportunity for the different counties and all to, and the lawyers at various levels of the government to talk to each other and share success stories. Before we take other questions, I do want to comment. In my career, this is the first meeting that I recall. We've got throughout the room, we've got county councils, we've got state agency councils, state departments. Kevin Milne in the front here is the Assistant General Counsel at Region 9 of the federal government, and his Ann Hall, the Chief Counsel for Region 9, was here the other day. This is the first meeting that I recall in my career where we've had all the levels of counsel together talking about common problems, and I think that's a real positive step as well. So anyway, we've got some time now for questions, and I think there's a mic that's available. If folks want to raise their hands, and we'll. Goodness. Nothing? Oh, I'm sorry. There we go. Oh, I didn't like. It's hard to see with the light.
Yeah, I'd like the panel to address a little bit the issue of permission, the initial permission that's given, and how this California law works in terms of what are you giving permission for? You may be giving permission for A to give it to B, but what about B giving it to other people?
That's a good point, and I can think of an example that came up in my career when HIV/AIDS was first a major issue. Of course, most states passed confidentiality laws early on, and I recall being at a meeting with New York State, and where we had the same issue, and it was handled completely differently in both states. The issue was when you take a child that's born HIV positive, do you let the foster parent know? In New York State, they felt that because when a child is born HIV positive, it's because the mom was as well, and even if the mother was dead, it was a confidentiality violation, so they wouldn't tell the foster parent that the child was HIV positive. In California, we took the opposite and kind of a compromise approach. We decided to tell the foster parent, but tell them that that information had to remain confidential with them and that they couldn't share it further. And we had written agreements with them that they could share with medical personnel as necessary for the treatment of the child. But when you're writing the note to school, you can say Johnny had the mumps or the measles or whatever, but not that Johnny was having his HIV treatments, etc. So I think it's important that when we design our systems in the future, we make sure that that sharing, it's not just black and white, either you get it or not. It's some people will get some information, and it will come sometimes with conditions that it not be made public further. So that's pretty much, I believe, how we operate in California.
And I mean, you specifically asked about permissions, and when you say that, I'm thinking of actually getting client permission or authorization. And I think it is really important on that. Your release form can say whatever you want it to say. I mean, some of the laws require you to lay out explicitly the purpose that you're going to use the information for, and you just need to make sure that you're addressing the purposes that you foresee down the line. And that's actually one of the things I've done with some counties, is really make sure we go back to those forms and say, is this actually addressing all of the needs that you foresee or the ways you might want to use this information? I think where it gets more challenging is when we take advantage of some of the quote-unquote exceptions in the law. So for example, even though HIPAA and CMIA generally require an authorization to release information, there are exceptions that allow an agency to share that information without need of an authorization. That may be for that release is authorized for a specific purpose, but now it's in your file. But if you want to use that for another purpose, you may need to go back and get client authorization, or go back and see if that's in turn authorized. And it also goes back to what Suzanne was saying about, does the law follow the data, or does it attach to the agency? And so that's where, I mean, you just really need your lawyers to help map this out. Is that fair enough?
Yes.
Larry, I thought this was really a great discussion from different points of view, and it's very helpful. After lunch, we're going to be designing a roadmap and a to-be world. So harvesting some of the experiences that each of the speakers has had, I'm wondering, what are the 2 or 3 things from each person's perspective that should be on the to-be, in addition to get your lawyers in early? But can you generalize up to what kinds of conditions and activities you'd like to see people in this room undertake in the to-be world of the future to avoid some of the challenges that you all have experienced and worked through?
Anybody want to start?
For me, one of the first things is the law. Is the law. And the idea is you know how you want it to operate in the future. Our current law was written easily in the 1970s and 80s. And it's very one-use purpose. And I think we're looking at trying to leverage the data. So we need to create a legal framework in which leveraging the data is a permitted use. So to me, I think that's one of the first things, is to free up the laws to allow greater use and discretion for the use. But with that is going to come another tie that you're going to have to be accountable, more transparent in your decision making, and probably have more of the data subjects involvement.
I'll make a comment. When Kristina made reference to Welfare and Institutions Code 10850, starting with the no, rather than plead the fifth, I'll say, when we wrote 10850, 39 years ago. Now, that statute is based on federal language that isn't even in the law anymore. It's based on the AFDC program, which is now TANF. It's based on the old food stamp statute, which is now got different, what is it, SNAP and CalFresh, et cetera. The re-looking at the laws is something that makes a lot of sense at this point. I think out of this effort, hopefully, we'll have departments re-examining their and looking at areas where their policies can be changed administratively and to make things function better, or if necessary, where legislative change is appropriate. And I know we've got representatives here, staff from both the Assembly and the Senate that are interested. There could well be legislative proposals by the time we reconvene in the fall. At the state level, as well as recommendations to federal agencies that their policies should be changed, or, if necessary, that federal law be changed. Look what happened with the FERPA issue, where the schools weren't sharing with the child welfare system in certain circumstances, and Congresswoman Bass, who happens to still be a member, she was one of the founding members and still is on the Blue Ribbon Commission. She put through legislation to try to solve that problem, and I believe Assemblymember Stone is following through with some legislation as well. And I think that if we need to make recommendations for law changes, hopefully some of those things will come out of this process. So,
I think to put on the to-do list for the legal community is in a very objective way. Review the laws again. Make sure that what we've been saying for these many years, the law actually says. So before we change it, let's make sure that it hasn't become sort of a very strong myth that is sometimes much harder to break than what the law says. Make sure that we don't have a policy, not a law, that was created based on a law, but the law really doesn't say what the policy says, so that before we change the law, we make sure that the law really isn't a barrier, but it has been used very effectively as a barrier. So that would be on my to-do list.
I think that's a point well taken.
Yeah, I would just add one more other than legislative change, which I would really appreciate, is one of the issues in talking to our departments before coming here that I've heard raised is a lot of times there's a lack of training at the different department levels on what is an allowable piece of information to share. I know one particular instance, and Larry talks about this a lot, is the sharing between schools and the child welfare agencies, where our child welfare agency will work with somebody at a particular school or school district and get them to understand that they can share information with us, only to have that person leave and they have to start fresh. So if there was some sort of unified training materials or packet that we could supply to people to have a continuity of understanding of what's allowable, that would be extremely helpful.
I would agree that would have been helpful, and for that matter, if the federal government were willing, as we've been talking about the toolkit, which is imminently going to be released, that's been in the works for how many years? If education had given some guidance on FERPA, it would have been helpful. Unfortunately, the bureaucracy in Washington doesn't get legal opinions out quickly sometimes. But I would agree, the more we can get out words to the county that they could use in training and all, the better.
I guess I would just go back to that question I started with when we say that balanced or appropriate information. What information do we need? What are we talking about? And do we sort of maybe take it in layers and sort of take the low-hanging fruit, the stuff we can all agree on first, and think more about sort of how much more nuanced we want to get, particularly when we talk about some of the more sensitive information that each of our agencies hold, whether it's HIV status or mental health information, et cetera.
Right, and obviously it's going to vary, as you said. The age of the child, for example, makes a difference. What kind of, when a foster parent takes a kid into the emergency room that's 5 years old, they're not going to get the kid's lawyer there to help to waive confidentiality. The doctor's going to talk to the foster parents. Or I think some of you who have been at the Blue Ribbon Commission meetings recall Justice Moreno, who chaired the Blue Ribbon Commission, talking about how getting medical treatment, in fact, in one case, dental treatment for his, I think she was 5 years old, his niece at the time, and she'd been placed from out of state, I think from New Jersey, and the social worker in New Jersey was upset that he'd gotten her cavities filled without her consent, without the social worker's consent or something. And it's like, my God, it's, we have to, we entrust these children to foster parents, in this case a relative foster parent who's a Supreme Court justice, and he has trouble navigating the system. So it says something about the restrictions we've all built up. So I think it's also, the title of this session was getting to yes. Sometimes it's yes, but, because not everything goes out to everybody. Certain information can go to certain people. It's got to sometimes have conditions on it, and it needs to be limited. So we don't want to, in trying to fix one problem, create another. So, Jerry. I'm sorry.
Hi, my question is about social media. It's becoming ubiquitous, and our social workers are interacting, exchanging, talking with the foster kids under their care through social, Facebook, Twitter. We do not have control over that information. The privacy is not protected. So your views and thoughts about that type of interaction and where we go about protecting the privacy and the information it's in those social media.
Anybody?
It scares me. That's my response.
I'm afraid this panel's too old to answer that question. I'm a Twitter to try to find an answer to that question. So
But stay tuned to the next panel, because we'll get ready right on top of that one.
Next panel, we're bringing a bunch of youth in, and they'll be happy to answer. No.
No, but it's a good question, and certainly we don't want to you don't want to limit the foster youth's right to do things that other kids do. But a lot of kids are real stupid about putting stuff on the internet that's going to last forever. And I don't think government wants to be in a position of trying to get too involved in that. But it's a valid concern.
It's not limited just to children, since former Representative Weiner announced his candidacy for mayor. So he'll be living that down for a little bit.
He clearly believed in sharing to the maximum extent.
A little too much.
At any rate.
His best attributes only.
Well, we in HHS do know that OCR, the Office for Civil Rights, has brought enforcement actions against providers who have responded to criticism on Yelp or other forms of social media. That the media doesn't necessarily, the form of the media doesn't necessarily insulate a covered entity from
penalties or sanctions under HIPAA privacy rules. So
right,
that is a fairly common occurrence.
So they fine people for their Yelp comments.
Sure. For example, a patient will get on Yelp and complain about a particular provider, and then the provider will respond on Yelp.
Bad idea.
Right, but lots of them do it, thinking that it is okay for the provider to do that. They're just responding to a comment or a criticism on Yelp or some of the other forms of social media. So the form of the media doesn't necessarily insulate you from sanctions or penalties.
That makes sense.
And I'll just say, on the county side, we do have a Facebook page that I was not too excited that we started. But one of our things we have done is put in big bold letters at the top that everything is public that's posted on the website, and we strongly discourage our social workers from utilizing it for communication with with clients. And we monitor it because you can remove comments that are made to make sure that nobody's confidentiality or confidential information is being disclosed improperly.
This is more of a number of comments than it would be a question per se. And I think the first thing I would say is when it comes to how we how and when we discover and establish ways to share information in a very protective way, that training and fidelity to that training and fidelity to the practice is a important component in any part of this conversation. And because I think that's one thing that's very much missing in this kind of conversation, right? We can always put on paper what this is, but when we walk out the door, it's important for us to not forget that there's an important role to continue to be played in making sure that the investment that we're making today lasts the day after the day after the day. In regards to I've heard references to toolkits and be helpful to have toolkits, actually, kind of just to I guess promote Rebecca as well. The American Bar Association actually has a data information toolkit that I believe actually Rebecca worked on a little bit with. That's available online. My apologies. That is available online. It's a very thorough toolkit, and it's not limited just to health information, but it's also in relation to educational information, and it's purposely for foster youth. So that's a very informative toolkit I think that folks can use as they move forward. There's also a recent Government Accountability Office report that really highlights a lot of the myths and realities that come along with informational sharing that I would very much encourage folks to look at, because it demonstrates how other states are really moving beyond some of these misunderstandings and focusing on the commonalities of goals and how we serve foster youth. And then lastly, for those of you who don't know, my name's Chris Reef. I'm a consultant with the Assembly Human Services Committee. My chair was mentioned by Larry, Assemblymember Stone. He's had the first of what is intended to be a series of informational hearings on how we promote and provide for the safe informational sharing for foster care. And so very much hope to hear from all of you in that regard. Our next hearing will be regarding really focusing some on the specific areas of educational sharing, health information sharing, and then maybe dabbling a little bit in the technological side of interoperability and portability. So thanks for allowing me to be here.
Yeah, thank you, Jerry Skinner again. I want to come back to Larry's example about taking the foster kid to the dentist, and Richard's about the myth versus the law. And I've given a lot of talks to people about liability. People are obsessively concerned about liability, and often unreasonably so. And in our society, I set up a hypothetical. It's just ridiculous. And then I say, can they sue you? And the answer is yes, anybody can sue you anytime. And I usually say, you can sue me for this talk because it's too boring. But my point is, the law, and we as lawyers need to remember this, the law, exalts the reasonable standard and generally tries to be reasonable. And if you act reasonably, you're usually not going to be liable. And we recently had an example in this administration where people said, well, we can't give legal advice, we could be sued. I said, that's our job, is to give legal advice. Yeah. So, and if we're sued, we have a lot of immunities, and we have also, in private world, insurance to cover that. So I think when we're analyzing these problems as lawyers, we need to ask ourselves, when our first reaction is the law requires this, is that a reasonable result? Is that really what the law wants us to conclude, that we should act stupidly? And secondly, if we're wrong, what can happen? What's the worst thing that's going to happen? What's the remedy? And if there isn't a remedy or nothing bad's really going to happen, let's not be frightened to death about acting reasonably.
Jerry, nobody's ever accused you of being boring, so.
And Jerry, I just have to remark that one of my first law professors stood up and said, as a lawyer, when they ask you, can I be sued, your hardest answer is to say, yes, you can be sued. And he then used as an example, which I don't think you could use anymore. He would say, look, someone could sue the Bishop of Boston for bastardy, but you won't win. now, unfortunately, you might win. So I, you just have to use your remarks. But then again, we're old, so. I also was going to make a comment after Larry's example about the California justice who took his niece in foster care in New Jersey to the dentist, and how the New Jersey social worker was angry. I was going to say, look, I live in Pennsylvania, and it's like pulling teeth working with New Jersey child welfare. But he didn't let me. But I made it so I could.
Jim?
Yeah, we did a conference. We have the County Councils Association. We do a conference twice a year. And one of the issues we covered last time was basically social media. And I think the consensus among the county attorneys was basically that social workers probably should not be doing casework on social media. I mean, that wasn't the exact topic. But we have had cases in LA where we've had people post things on YouTube and Facebook and stuff like that, and we've been pretty successful identifying the breaches of confidentiality with 827 and getting them to take them down. If it's like a family member and it doesn't exactly identify the child, I mean, I think that they probably have a First Amendment right to do whatever, but if they start doing personal stuff that we think the juvenile case laws protect the kids' confidentiality. If that's jeopardized, we will proactively try to get them to take it down.
Appreciate it. Are there other? It's hard to see with the lights shining in our eyes. Are there other questions? We're going to meet again in the afternoon. The sign-up lists again are over there, and there is a confidentiality and privacy group. So I would encourage anyone, not just the attorneys, but anyone interested, particularly in this topic, to sign up. Daniel?
I actually just had one question before we wrap the session, which was about the topic of opting in or opting out, which seems to be pertinent. A number of counties are working with that, and I'm wondering if you can address that as an option. Every time I go to the App Store and I see that 30-page form, that I know exactly what's on every page of that, and so just check it versus opting out.
Let me just clarify. It's in reference to the authorization process, and opting in means you have to specifically give permission to share this piece of information with that other entity for this purpose. Then there's the opt-out, which is a clear consent, which says this information will be shared with the following entities for the following purposes, unless you specifically opt out, sharing it with whom or what. So it's two ways of dealing with consumer, client, customer giving authorization.
Some of our laws are going to require the opt-in, especially if the law says you can't do this unless you get an authorization, and the requirements of the authorization are also in statute, and it requires the signature before you do the disclosure. So opt-in is often what is required by law. There's the technology. It almost doesn't matter, opt-in or opt-out. The process is you need to give an informing to the patient or the data supplier what it is that you're going to do, give an adequate informing, and then do a consent. The adequate informing can be layered so that you don't, you're in the emergency room, you need to have surgery, now you've got a 30-page form. The concept is you do media outreach and education so that the first time someone is looking at that authorization or opt-in, they already understand it and they know it, and hopefully they've done it long before the emergency arises. So part of the difficulty, or what we were hearing a while ago, is the favoredness of opt-out is that the data was already in the stream and flowing, and then they waited until the individual had contact with the system and then asked for the opt-out. Whereas with an opt-in, the data would not be in the stream.
Just on the consumer side, I'll say I'm working with one county right now where we've drafted some new forms, and we're actually going to do some focus groups with parents and kids to see how they respond, because one of the things we'd heard is that they don't often, there are a certain percentage of people who simply refuse to sign, and to see how they respond to sort of both types. So really trying to go to the consumer and make sure they understand what it means and which one feels more comfortable to them.
Daniel, do you have any final comments?
Well, I just
Well,
would.
there are other jurisdictions have also, Rebecca, done this kind of focus groups, and people have said they find the authorizations annoying. They don't read them to begin with, and they just sign to finish the registration. And some other clients say, I'm given 30 pieces of paper to sign at the same time, and if I really took the time to read it, my appointment would be over. So I think the whole area of consent needs to be looked at in a clearer way, especially with computers and going paperless, and people being much more comfortable reading on a computer as opposed to paper. So I think that it's an open question and one that any jurisdiction should look at carefully.
I was just going to say I would nominate that to be on the what's next we look at, both the opt-in, opt-out, but I also really like the idea of looking at it from a consumer perspective. Again, we bring a lot of assumptions about what we think they want or what they don't want, and there's really not, there's a little bit of data, but not really enough, and it might help inform, some better decision-making from some data.